In 2022, UnitedHealthcare's AI model denied 22.7% of all post-acute care claims. 9 out of 10 of those denials were wrong, not disputed. Reversed. The company read the appeals data. Internal working groups analyzed the appeal patterns. The algorithm kept running. That algorithm has a name. It is called NH-Predict. It was developed by a company called naviHealth, a subsidiary that UnitedHealth Group acquired in 2020 for what the company described as an investment in care management technology. NH-Predict was trained on a database of 6 million patient records. And according to a class action lawsuit now moving through federal court in Minnesota, UnitedHealth deployed it knowing the error rate and kept deploying it because they also knew something else. Only 0.2% of Medicare Advantage policyholders ever appeal a denied claim. And the part of this story that almost no coverage has reached is what the company was building in December 2022 to manage the 0.2% who do. What NH-Predict actually does, what UnitedHealth's internal documents reveal about how it was used, and that December 2022 project are what this investigation documents. The information comes from the U.S. Senate Permanent Subcommittee on Investigations report titled Refusal of Recovery, released October 17, 2024, from the CDAT News investigation that preceded it, from ProPublica's reporting on Cigna, and from the class action complaint filed in the U.S. District Court for the District of Minnesota. No unnamed sources, no speculation. Every number has a named origin. To understand what NH-Predict does, you first need to understand the system it operates inside. Medicare Advantage is the private insurer alternative to traditional Medicare. As of 2022, it covers more than half of all Medicare beneficiaries in America. That is roughly 30 million people who have shifted from federal administration to private insurers. 3 companies control nearly 60% of that entire market: UnitedHealthcare, Humana, and CVS Health, which owns Aetna. These 3 companies set the prior authorization criteria, define what counts as medically necessary, and determine how long a patient stays in a nursing home after hospital discharge. The choice you think you are making when you select a Medicare Advantage plan is not the choice the marketing describes. Between 2019 and 2022, according to the U.S. Senate Permanent Subcommittee on Investigations, all 3 were denying post-acute care claims at rates they had never reached before. In 2022, UnitedHealth and CVS each denied post-acute claims at approximately 3 times their overall denial rate for other services. Humana denied post-acute claims at a rate 16 times higher than its overall rate. Post-acute care means skilled nursing facilities, inpatient rehabilitation hospitals, and long-term acute care hospitals. These are the places where elderly patients recover from strokes, fractures, joint replacements, and serious illness. This is not a category of borderline claims. These are the recoveries that determine whether someone goes home functional or goes home to die faster than they should have. Here is exactly what NH-Predict does and how it works in practice. When a Medicare Advantage member is discharged from a hospital and needs to transition to a nursing facility or rehabilitation center, naviHealth's system is activated before a UnitedHealth physician reviews the case. The algorithm pulls data, the patient's age, their diagnosis, their living situation, their prior functional status. It matches that data against 6 million similar patients in its database. From that match, it generates a report. The report includes a predicted discharge date, a predicted length of stay, and a down-to-the-minute assessment of the patient's expected recovery. A 6-page document reduces a human being's recovery to a series of numbers and graphs. That document is generated before the treating physician's recommendation is reviewed. According to internal documents cited in the 2023 Stat News investigation, later referenced by the U.S. Senate, naviHealth set a target for its clinical staff in 2023. Keep actual patient rehab stays within 1% of whatever date the algorithm predicted. Not within 10%, not within 5%, 1% enforced regardless of how sick the patient actually was. Former naviHealth employees told STAT that missing that target exposed them to discipline, including possible termination. The algorithm's prediction was not a guideline, it was a quota. The 1% performance target is documented in internal corporate records. There is a second directive that received almost no coverage. In April 2022, naviHealth issued a formal instruction to its customer service representatives. The subject was how to handle phone calls from doctors and hospital staff asking about denied prior authorization requests for post-acute care. The instruction reads, "Do not guide providers or give providers answers to the questions." Those are the exact words quoted directly in the Senate subcommittee's report. The mechanism that denied the care was also designed to be opaque at the point of contact. Physicians could not get an explanation. They could not identify which specific criterion their patient failed to meet. They were told a decision had been made and given nothing to work with on appeal. In practice, what this produced is documented by Christine Huberty, a Wisconsin attorney who provides free legal assistance to Medicare beneficiaries. Huberty told STAT that the patients she represents rarely stay in a nursing facility more than 14 days before receiving a payment denial from their Medicare Advantage plan. Under traditional Medicare, a patient with a qualifying 3-day hospital stay is entitled to up to 100 days in a skilled nursing facility. One case management director in San Angelo, Texas, named Christina Zitting, documented naviHealth's applied standard in a submission to federal regulators. naviHealth will not approve continued skilled nursing care if a patient can walk 50 feet, not whether the patient lives alone, not whether they have poor balance, not whether they have anyone at home. 50 feet, that is the criterion. In December 2022, UnitedHealthcare formed an internal working group. Their denial rate for post-acute care was already at 22.7%. 9 out of 10 appeal denials were already being reversed. The working group's task was not to audit NH-Predict's accuracy. The task was to build something new. An internal recap of that working group meeting, obtained by the Senate subcommittee and included in the October 2024 report, describes the objective: to determine what we could do in the clinical review process to change the outcome of the appeal. That is the direct quote from the internal document. UnitedHealth was not building a second system to reduce wrongful denials. They were building a machine learning model to predict which wrongful denials the company could successfully resist in the appeals process. The architecture becomes clear when you lay it out. System 1, NH-Predict, generates the denials. System 2, the December 2022 project, models which of those denials the company can win when challenged. The 99.8% who do not appeal are already accounted for. The 0.2% who do appeal are now facing an insurer that has run a model on their probability of losing. This is documented in the Senate subcommittee's report. It is not alleged. The internal meeting recap is in the public record. The information existed. It was not in one place for the people it most affects until now. UnitedHealth is not the only company in this investigation. CVS Health owns Aetna. In 2018, internal CVS documents obtained by the Senate subcommittee show the company saved $660 million by denying prior authorization requests for inpatient facility care across its Medicare Advantage plans. In April 2021, facing pressure to cut costs further in its Medicare Advantage division, CVS deployed a new algorithm for post-acute care. The internal projection at launch was $4 million in savings per year. Within 7 months, that projection had been revised upward to $77.3 million over 3 years. What the Senate report documents and what almost no coverage surfaced, CVS also built and tested a model specifically designed to maximize approvals, to approve more care for patients. They found it too expensive. They deprioritized it. The technology to approve more claims existed within the company. The decision not to use it was a deliberate internal calculation, documented in the subcommittee's records. Cigna built a different system, Cigna called it PXDX, an abbreviation of procedure to diagnosis. According to internal Cigna documents reviewed by ProPublica and the Capitol Forum and published in March 2023, Cigna's medical directors use PXDX to deny claims in batches. Over a 2-month period in 2022, 300,000 claims were denied through PXDX, with an average review time of 1.2 seconds per claim. Dr. Cheryl Dobke, a Cigna medical director, signed off on 60,000 denials in a single month. According to internal Cigna records reviewed by the journalists, a second Cigna medical director, Paul Rossi, denied more than 63,000 claims in 2 months. Cigna's former chief medical officer, William Muni, confirmed the system's design on the record to ProPublica. The PXDX stuff is not reviewed by a doctor or nurse or anything like that. It has undoubtedly saved billions of dollars. Gene Locken was 91 years old. In May 2022, he fractured his leg and ankle and entered a nursing facility to recover. After a month of initial healing, his doctor approved him to begin physical therapy. UnitedHealth and naviHealth paid for 19 days of that therapy and then determined he was safe to go home. His own doctors and therapists filed appeals. Their documentation said his muscles were, in their words, paralyzed and weak. Every appeal failed. Over the following year, Gene Locken's family paid approximately $150,000 out of pocket to keep him in the facility his physicians said he needed. He died in July 2023. His estate is the lead plaintiff in the class action estate of Locken versus UnitedHealth Group, currently moving through the U.S. District Court for the District of Minnesota. In March 2026, a federal magistrate judge ordered UnitedHealth Group to produce internal documents across 6 of 7 categories requested by the plaintiffs, including communications about NHPredict, employee performance data tied to the algorithm, and records of how the system was deployed before and after naviHealth's acquisition. The case is moving toward class certification. If certified, it would cover every Medicare Advantage member denied post-acute care through NHPredict across the country. Gary Bent's husband was a cancer patient in immunotherapy. naviHealth denied his nursing home care multiple times. After being sent home from the 3rd stay, he developed bacterial meningitis. He died in March 2023 at 82. Gary Bent testified before the Senate subcommittee. The lawsuit describes the appeals process that preceded these deaths as so arduous that plaintiffs suffered worsening injury, illness, or death as a result of the denials. Those are the documented outcomes of the named plaintiffs. Here is what the information actually changes for someone on a Medicare Advantage plan. First, find out whether your plan uses naviHealth, now rebranded as Optum Home and Community Care, to manage post-acute care authorizations. Ask your insurer directly in writing if they use naviHealth for skilled nursing facility or inpatient rehabilitation authorizations. Discharge dates for those stays are being generated by NHPredict. That is not a disclosed fact in the plan documents most members receive. Second, if a post-acute care claim is denied, request the specific clinical criteria used to make that determination in writing within 24 hours of the denial. UnitedHealth is required to provide this under federal Medicare Advantage regulations. Without it, your appeal window may not have legally started. Third, file the appeal. The Medicare Advantage formal appeal window is 60 days from the denial. In 2022, the HHS Office of Inspector General found that 75% of appealed prior authorization denials were overturned at the first level of review. In 2025, the Kaiser Family Foundation found that 82% of people who appealed a Medicare Advantage prior authorization denial succeeded. The reason the system functions the way it does is documented in the lawsuit itself. UnitedHealth's own internal analysis showed that only 0.2% of policyholders file appeals. The system was calibrated against that number. A patient who appeals has already stepped outside the behavior the system is built to rely on. Fourth, if a treating physician has documented that continued care is necessary and the algorithm has overridden that recommendation, keep every physician note, every denial letter, and every communication in writing. Send all correspondence by certified mail with return receipt. The plaintiffs who have prevailed in appeals consistently succeeded because they had a documented paper record the insurer could not contradict. UnitedHealthcare's denial rate for skilled nursing facility admissions rose from 1.4% in 2019 to 12.6% in 2022, a nine-fold increase. naviHealth, the company processing those denials, told its own staff not to explain them to the physicians filing appeals. An internal working group then built a second system to identify which wrongful denials the company could successfully defend. CVS tested a system to approve more care and chose not to use it. Cigna's medical directors signed off on 60,000 denials a month at 1.2 seconds each. All of this is in the public record. The Senate Permanent Subcommittee on Investigations report, October 17, 2024. The class action complaint, Estate of Locken versus UnitedHealth Group. The ProPublica investigation, March 2023. The Estat News series, November 2023. The information existed before this video. It was not in one place for the people it was most relevant to. It is now. If you want to understand how the same denial architecture operates inside the commercial health plans most working Americans carry, the investigation into how prior authorization works for non-Medicare coverage, who controls those systems, and what the legal exposure looks like is in the next video on this channel.